patient? Right. So if you have read and understood, considering this critical care scenario, kindly tell me, how do you plan to manage this patient now?
I will manage this patient according to Chris protocol.
Yes.
I'll first look for the airway. If he can talk, then airway is patent. Then I will go
Yes.
for checking of breathing. As he's complaining on chest pain and a feeling of tightness and shortness of breath, so I will look for breath sound.
Yes.
And I will look for resonant. There may be hyper resonant chest. I will seek for any subcutaneous emphysema present or not, and I will assess the chest wall movement. According to that findings, I will manage the patient accordingly. If this is a tension pneumothorax, I will decompress this by needle thoracostomy in the second line
Okay.
at the mid clavicular point.
Sorry, I have to interrupt you. How would you assess the breathing of the patient?
Assess by look, feel, and move.
Anything
By
else?
anything else?
Yes, you'll consider or you'll keep in your mind the respiratory rate,
Respiratory rate,
rhythm, and the oxygen saturation.
oxygen
You'll look at the
saturation.
trachea, if it's central or deviated. You'll
Deviated,
take
I
care of
will
the
go
chest movements.
take
You'll also note if patient is using accessory respiratory muscle.
accessory respiratory muscle or not.
Then you'll also look at the pattern of respiration. If you'll inspect the color of the skin, nail beds, etc. You'll care for the
And
percussion.
cardiac indices.
Yes, all these, and respiratory also, because you'll
And
consider the
JPP,
yes.
JPP also.
Yes, so all these things you have to tell me in one go. Very good. Okay, if you can
Okay.
tell me how would you confirm your diagnosis?
I will confirm my diagnosis by doing a plain X-ray chest
All
peer
right.
view.
Okay. If you can help me to read this X-ray, please.
This is a plain X-ray chest peer view showing complete
Yes.
collapse of lung of right-sided,
Right.
mediastinum
Wait. Right-sided.
sorry, left-sided lung collapse,
Yes.
and
And
mediastinum deviated to the left side.
okay. What these arrows
And
point at? Point at. Yes. More.
and there may be diaphragmatic injury of the
Yes.
left side, as there is a stomach gas shadow is seen in the chest wall.
Very good.
And
Yes.
trachea also deviated,
Yes.
and the thoracic spine curvature
Curvature also. So
also
it
lost.
signifies yes or not aligned. Okay.
Yes.
Very good. What else can you say? What about the exposure? Is
It
it
is not
adequate?
properly, no.
No. Very good.
Both diaphragm is not seen.
Not seen.
I
Very
cannot
good.
see in the costophrenic angle
So
clearly.
if you consider this to be pneumothorax, how many types of pneumothorax there can be?
And there may be open or closed, simple or
Yes.
tension pneumothorax,
Very
primary
good.
or secondary.
Okay, very good. Can you tell me if you'll interpret this patient's symptoms? Patient has shortness of breath and respiratory rate 30 per minute and heart rate is 123 per minute. How would you assess? What would you think? What patient is suffering from? What type of pneumothorax, if I have to ask you?
It might be a case of tension pneumothorax.
Okay, define tension pneumothorax, please.
And there is tension pneumothorax in which the patient may be in respiratory distress. There
Okay,
is ipsilateral reduction of chest wall movement, decreased
yes,
breath sound,
yes,
tachypnea and hypoxia present,
yes,
hyperresonant sound on affected area. There
yes.
might be subcutaneous emphysema,
And there
blood
could even
pressure
be, yes,
lowered,
yes,
JPP raised, and there may be
cardiovascular
pulsus
compromise.
paradoxus
Very good.
and
Yes.
cardiovascular
How this
compromise.
patient should be managed? What would you do?
This should be managed by emergency urgent needle thoracostomy
Yes.
at the second intercostal space at
Okay.
mid-clavicular line.
All right.
After that, I will assess the patient and follow-up X-ray of the done. Then, if needed, tube thoracostomy can be
What do you
done.
understand by the term safe triangle for the insertion
Uh,
of chest tube?
if it is bounded anteriorly by the lateral border of pectoralis major, posteriorly by the
How would you,
mid-axillary.
yes, make sure that according to the NICE guidelines, you are inserting the chest tube?
According to NICE guideline, the insertion must be under ultrasound guidance,
Very good.
and there must be a post-procedure radiograph for
Very well.
the
Very good.
placement of the tube and if there is any sign of
Okay.
pneumothorax
Can
present or
you
not.
now tell me, please, the technique for the insertion of central venous line?
Okay, there is anatomical landmark
Yes.
above the, and there is a triangle in between two head of the sternocleidomastoid muscle
Yes.
and the clavicle. Apex of the triangle. At first, we have to identify the carotid pulse. Then laterally, there is internal jugular vein. In that landmark, we have to do the central venous line.
Can you please tell me the surface markings for internal jugular vein?
It is a straight line from the mastoid or ear lobule
Ear
to
lobule,
the
yes. True.
to the clavicle in
Medial
between
end.
two head of the medial end of the clavicle in between two head of sternocleidomastoid
Very good.
muscle.
Can you name few indications when this central line needs to be removed or should be removed?
Removed.
Yes, removed.
Of the indication
Yes.
and when resolution of acute problem,
Yes.
if there any kind of sepsis or
Yes.
when patient can be discharged.
Yes. And also in case of if patient was getting cardiac inotropes and does not need anymore, so then
Does
we
not
can
need
also.
any
So
when
what
the
is
indication is over.
is over. Very good. So can you please tell me what is the technique that you'll use to remove the central line?
To remove, we have to do the head down to prevent air embolism.
Very good. Okay. In case patient, if in case you are inserting a central line, there are certain organisms which are also associated in causing infection. Can you name few?
Sorry,
Staph
I didn't get that.
Staph epidermidis.
Name of
Can
the
you
organism.
organisms that can
Staphylococcus
cause
epidermidis.
infection? Yes. Can you tell me what measures can you take in order to prevent the infection of the central line?
We have to perform this technique with very hygiene protocol.
Yes.
We have to maintain the hand hygiene, apply appropriate skin antiseptic,
Yes.
ensure that skin preparation agent is completely dried before the insertion of central line, and use all
Yes.
the line is in place, we have
Yes.
to follow the recommended central line maintenance practice. We have to wash hand with soap and water, or if not possible, alcohol based hand rub before and after touching the line, and remove.
Very good. Last question. Other than infection, can you name few complications that can occur or arise as a result of central line insertion?
There are some early complication and late
Very
complication.
good.
Early
Very good.
complication
Yes.
might be pneumothorax or hemothorax,
Yes.
thrombosis like air embolism or arrhythmia. There may be injury which may lead to cardiac tamponade or
Very good. Like
arterial
perforation of right
puncture,
atrium. Very good.
perforation, and late complication there might be infection or sepsis.
Yes, and there could also be damage to the thoracic duct leading to
Yes,
pylothorax.
chylothorax can be
Very
occur.
good. Very good. Okay. Excellent. Thank you. That was wonderful.